Documents obtained by reporters and private citizens contain heavy redactions applied by the Biden administration. Yet, despite these obstructive efforts, these individuals initially raised awareness of Biden's administration's failure to immediately warn the public about myocarditis and other serious adverse events linked to the COVID-19 injections. After facing 4 years of the Biden administration's efforts to undermine the public's access to information in my oversight work, I immediately issued a subpoena to HHS when I became chairman of this committee. The subpoena records I am releasing today, which are discussed in the interim report, do not contain FOIA redactions and will finally provide the public a more complete understanding of the Biden administration's awareness of the risks of myocarditis following COVID-19 injection.
There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. A 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection is ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Really horrifying, right? First you heard Senator Ron Johnson and then Dr. Peter McCullough yesterday on a new report led by Senator Ron Johnson that the Biden White House knew about deadly heart risks tied to COVID shots like myocarditis, but deliberately hid it from Americans. Joining us now, internist and cardiologist, you just heard in that testimony, Dr. Peter McCullough. Doctor, always great to have you on, but Biden officials, Dr. Fauci, far-left liberals attacked and bullied and silenced Americans who raised concerns about this, and now we're going to see red flag warning labels on COVID shots. This is a total disgrace what happened to Americans. You know what happened in the pandemic? It turned everybody on the street into bullying bureaucrats. That's the problem.
Congratulations to Senator Ron Johnson and his persistent, diligent efforts to uncover the truth. That report you just showed is 54 pages. This is a synopsis, 217 citations. We had multiple experts testify to really our observations that this was a serious complication, myocarditis or heart damage that can lead to cardiac arrest or heart failure. It was occurring, and the Biden administration and their public health agencies tried to cover it up.
So didn't the Israeli health officials warn the CDC 10 months into the pandemic in February about myocarditis from COVID shots, notably in young people after these Pfizer shots and Moderna shots? I mean, but then they still got emergency use authorization, and then by April, they were looking at the data, the CDC under Biden, from Israel and the Pentagon, yet instead of telling the public, they stayed quiet. Isn't the COVID shot a protein that actually circulates through the blood that we've never seen before?
It's true. We reviewed the Israeli communications. They had 62 cases of myocarditis very early on in 2021. 2 were fatal. Now research shows the spike protein produced from the vaccines circulates in the blood. The messenger RNA and the spike protein are in the human heart when it's examined at the time of autopsy. The vaccine is the direct cause of cardiac damage.
Totally frightening stuff. Dr. Peter McCullough, thank you for bringing us this story and staying on it. We'll stay on it as well. It's good to see you.